start. Well, Nicole, I have a couple of questions to you.
Mm-hmm.
The first question is, what problems did you face in the past that made you decide to have FFS?
Okay. Well, I decided to have FFS because most for myself rather than, of course, what I received from people, from the outside. Because I think people couldn't really understand, that I had some masculine features that were bothering me. But it was something that I would always see in the mirror every morning. So that's why I decided it more for myself because I think my passing was pretty good already before. And but now I think the different is the way I approach to people. It's much more out there and self-confident, and so it's a big change for sure.
Yeah. What has made you decide to have your FFS with us?
Well, I had my first consultation with you, Dr. Bart, and I did have some others, but I think in the end, like I think my first choice was the best. So I had a nice consultation with you. I was pretty sure you would have been, like the right one, and I felt good enough to put myself into your hands.
Nice to hear. You partly said something about it already. What has been the effect of facial feminization surgery on your life and on your passing?
I think living more carefree and don't think every time to be judged because of some features that were bothering me because for some people they were not even there, but for myself would be so much of a problem that would prevent me from being open, I think, to other people. And now it's a big difference because of course I have better job as well. I have better relationships also. Just overall the way I approach to everybody every day.
If you could give an advice to your former self at the beginning of your transition, what advice would you give to yourself?
Well, to the beginning of my transition, I think not to be too afraid because in the end, if you want something so much, you're gonna achieve it. And especially throughout this experience, I think not to be afraid of going through it. Maybe, I had some second thoughts like, should I do this? Is this the right thing for me? And will it be painful? But I think if I could talk to myself like a few months ago, I would say, don't be afraid because this is absolutely gonna be fine.
Okay.
Yeah.
Thank you very much.
No problem.